Hello and welcome. My name is Chris from ChristopherHall.com. Welcome to this video where we're going to be looking at bursitis. Now, if you think you have it, use this video as education to help you better understand it. Please do go and see a health or medical professional to get it properly diagnosed. If you've been told that you have it by a medical or health professional, hopefully this will help with understanding it a little bit better, and also maybe understanding some of the terminology that they may have used whilst talking to you about this condition. But first of all, I must just explain what a bursa is, and they are thin, lubricated cushions located at points of friction between a bone and the surrounding soft tissue. So they're sort of specifically placed around the body as, I guess, little cushion pads, if you will, to prevent any sort of rubbing and friction between different tissues, bones, ligaments, tendons, muscles, so on and so forth. As you can see here, surrounding soft tissues such as skin, muscle, ligaments, and tendons and things like that. So you can see here, there's one on the side of your hip. There's also one on the top of your shoulder between your sort of arm bone, if you will, and your shoulder blade and clavicle, which is your collarbone. One on the knee, and then there's one on the elbow as well. Now, there's sort of three different types of bursitis, if you will. You've got a frictional one, which occurs when the tendon repeatedly moves over a bursa. So if someone has told you that it's a frictional one or a frictional bursitis, that's why, because of the repeated movement of the tendon over a bursa. You've then got chemical, which is caused by a substance formed as a result of inflammation or inflammatory or degenerative conditions of tendons. So if you've watched my tendon injuries video, you've got tendonitis, tendinosis. If you've got either of those, that can create chemicals which can aggravate bursas and cause bursitis as well. What you've then got is septic, which is caused by a bacterial infection, either from blood or the external environment. And again, that can sort of start off the condition of bursitis. So again, very much just understand and educate yourself. Use this video as for educational purposes rather than a self-diagnosis or self-treatment, if you will. So go and see medical and health professionals, get it properly diagnosed, get it proper treatment as well, but also use this as sort of an education process to help you better understand what you need to do and maybe any terminology and sort of language that these other professionals may be using with you regarding these conditions. So many thanks for watching. My name is Chris from ChristopherHall.com, and I will speak to you in a future video.